This conference will now be recorded.
Good morning and welcome to episode 16 of the Hooved Animal Humane Society's Saturday Seminar Series. For 52 years, the Hooved Animal Humane Society has advocated for the humane treatment of hooved animals through education, legislation, investigation, and, if necessary, legal intervention. HAHS also provides physical rehabilitation to animals that have endured severe neglect and abuse and adopts them out to new homes. Each month, we are lucky to have veterinarians and subject matter experts educate us on topics near and dear to our hearts as horse owners and lovers. Today, we are talking about the dreaded hoof abscess. Heather Beauchemin is a full-time farrier practicing in Northern Illinois. She is the first woman in the state of Illinois to earn the designation of Certified Journeyman Farrier with a therapeutic endorsement from the American Farriers Association. Heather is also one of only approximately 35 U.S. Associates of the Worshipful Company of Farriers, founded in 1356 in the United Kingdom. To earn this credential, she took a written exam, 4 oral exams, and a practical test, which included fabrication of a shoe from plain steel, the correct fitting of 2 corrective shoes, and a test in the use of modern materials such as acrylics. Her first book, The Hoof Book, A Owner's Guide to Demystifying Hoof Care, debuted last year as the #1 new release on Amazon in the category of equestrian sports. We are so lucky and honored that you're with us, Heather. Take it away.
Thank you. You make me sound really cool with that description. Yeah, so thank you everyone for being here, and thanks to HAHS for hosting. I think this is a really cool series that they're doing where we can just get education on all different topics. So today we're going to talk about hoof abscesses. So our goals for today, I want you to be able to understand the anatomy that's being affected by an abscess, recognize the problem when it occurs, and be able to recognize it quickly and confidently. Have a plan in place for what to do when you do recognize it. Prevent any future abscesses that you can. And then know when to look deeper. So there are certain signs that we'll learn to recognize today that maybe tell you that you've got a bigger issue going on. And then, like Jen mentioned, feel free to jump in with questions at any time. I know it's a lot easier to ask the question when you think of it than to remember it until the end of the lecture. So we'll go ahead and get started. So hoof abscesses are an extremely common type of lameness. They typically occur without any warning. So, your horse is fine when it goes out one day, and then when you bring it in the evening, it's limping like it broke its leg. So that can be quite a disturbing scenario. It often occurs in otherwise healthy horses, so you don't necessarily get a lot of heads up that this might be going to happen. It can be quite a sudden thing to happen. The lameness usually rapidly escalates, so your horse goes from being sound to being extremely lame very quickly. And it is possible to see some very severe side effects if it's left untreated. So all of this can be really scary and make you feel very helpless. You don't want your horse to be suffering. And some horses may experience like repeated abscesses, and that it can be frustrating and confusing. So what do you do? What can you do to help this situation? Knowledge is power. With any hoof problem or any horse issue in general, knowledge is power. By educating yourself about the anatomy involved, the common symptoms, causes, and treatments, you empower yourself to understand the problem, recognize it immediately, treat it appropriately, and even prevent future abscesses. So what I hope you take away from this today is that you can make a difference when it comes to abscesses with your horse. So we're going to start off with some anatomy, and this is going to be really basic for some of you, but I just want to make sure that everyone's on the same page before we get into more in-depth stuff. So if this is all old hat, just hang with me for a minute and we'll get into more fun stuff. So our important structures to know for talking about abscesses is our hoof wall. So that's in this diagram, that would be this area, and then this is in the heel here. The coronary band, so that's right up here. This is the area from which the hoof wall grows. The white line, so that's this little area right here, so that grows from the tip of the coffin bone down, so the white line doesn't go all the way up, but it's down here at the ground surface of the foot. The lamina, so the lamina is both a sensitive and an insensitive structure. So the insensitive lamina grows off of the inside of the hoof wall, and then the sensitive lamina grows off of the coffin bone. And then the two of those lock together and basically are attaching the hoof wall and the coffin bone together. The sole, we all know what part that is. We pick out feet, we see it every day. And then the solar corium is the sensitive structure that's underneath the sole, and that is what builds new sole for us. So then just looking at another view of the anatomy. So this is the inside of a hoof capsule. So again, our hoof wall we can see on the outside, that's over here. And then our coronary band is this little scoop that goes all the way around the top of the wall. The coronary band would fit right in there. And that's growing this hoof wall underneath. The white line we can't see in this picture, but the lamina, this is our insensitive lamina here on the inside. So you can see it basically looks like mushroom gills or like a stack of paper. So the sensitive lamina would look very similar to that and just be mirror image and fitting into all those little tiny grooves that you see going this way. And then our sole is what we're seeing down here, and the solar corium would be a sensitive tissue covering this insensitive sole that we see right here. So then just one more review. This is a freeze-dried leg. So our hoof wall is here. Our coronary band is this structure right here. Our white line is this little stripe right here. And then our lamina, you can kind of see right in here between the hoof wall and the coffin bone. Our sole obviously is here, protecting the bottom of the coffin bone. And then our solar corium is right in here. All right, so now we've got those basics covered, we can move on. So what is an abscess? A hoof abscess is an infection inside the hoof capsule. It can occur anytime that bacteria finds its way inside the protective horn layer of the hoof. Once it's established, bacteria multiply and the body begins an immune response. As bacteria and tissue are both killed off, pus is created. And that's what causes the pressure in the hoof capsule, resulting in pain. So we know with a lot of immune responses in the body, swelling occurs because there's more blood going to that area. There's more, it's sending the white blood cells to try to fight the infection. But inside the hoof capsule is basically a closed system. It's completely surrounded by horn, and then you've got sensitive tissues inside it, and there is really not much wiggle room inside there. So once we add swelling, it's pushing out against all those insensitive structures, but all those nerves and everything that's inside there is being compressed. So it really can become very uncomfortable very quickly from a fairly small amount of swelling. So we have two basic types of abscesses, or two classifications that we put them under. So we have a subsolar abscess, which is an infection that occurs underneath the sole. So that's this whole area highlighted in green. Anything in that area would be considered a subsolar abscess. And a subsolar abscess is less likely to vent on its own because it doesn't have a clear path out of the foot. A submural abscess refers to one that's behind the hoof wall. So mural, you think about the big paintings on walls. It's an easy way to remember that one. So a submural abscess is typically the type that may eventually vent at the coronary band. So when you see a split at the top of the hoof wall there and so a little bit of liquid comes out of there, that means that that abscess has traveled all the way up the inside of that hoof wall and then reached out there. So if you had a subsolar abscess that's in here, it doesn't really have that easy path to get out there. It may eventually do that, but it's going to take a really long time and cause quite a bit of unnecessary pain. So we don't want that. So our causes for abscesses can be essentially broken down into three separate categories. So we have our environmental category, so that's sort of outside influences. We have injury, which can be like direct traumas to the hoof, and then disease, which is some abscesses can be secondary to certain conditions, and we'll talk more about that later. So our environmental causes are things like being in very deep mud. So mud is usually pretty heavy on bacteria, and it's also got a lot of liquid in it. So basically, if that liquid can absorb into your horse's foot, it takes that bacteria with it. So standing in slop like this all day, not ideal. But then on the other hand, frozen ground. So if you take that and then it hits, drops from 40 degrees to 10 degrees, as sometimes happens overnight here, then you end up with this really rough, ridgy, rock hard mud. So then it's very easy for them to get bruises. And then what we also know happens is that in the next day, it's going to swing back up to 40 degrees. So then they're standing back in this, but now they've got a bruised foot and they're standing in this bacteria-laden water. So anytime that we get bruising inside the foot and then bacteria can access it, that bruising is a really good source of food for that bacteria. So it can be a really good way to get an abscess. Unhygienic bedding can feed into it. I have not personally seen this be a primary cause, but if your horse is standing in, for instance, very deep bedding that has quite a lot of urine in it, it has actually been shown that soaking a hoof in urine causes the protective layer to break down, and so that allows more bacteria to get further into the hoof capsule. So it would be more of a secondary cause versus like just putting them in dirty bedding isn't going to immediately cause an abscess. But it's something to think about. Very rocky footing, again, going back to those bruises. If your horse is, say going out on a trail, normally they're on very soft footing and then you're taking them somewhere fun to go ride and it turns out that the trail is really rocky. They can get really bad bruises and then that can be a source of food for those bacteria. Similarly, very hard ground, especially when you compound it with a lot of flies like we get during the summer here. You end up with your horse standing there stomping for, an hour at a time. That can be some pretty severe trauma to that foot as it just slams into the concrete over and over. And then one that people don't always think of, those really lovely limestone turnouts, which I personally really like. Occasionally you can get a very small piece of limestone that works its way into that white line that we talked about earlier and just gets up too high into that foot. So if you do turn out in limestone paddocks, which I love them for like drainage and it's just so much cleaner, but just make sure that you're picking out that white line when your horse comes in if your horse is barefoot, so it doesn't have a chance to work its way really deep into the foot and create pressure. So then in our injury type causes, foreign objects can obviously be a really bad thing for your horse. So a horse like this that stepped on a roofing nail, that nail might be penetrating into sensitive tissues, and of course that nail was probably not clean when it went into that foot. So then not only are you dealing with the fact that you have a nail sticking into your horse's foot, but also all the bacteria that went along with that. So any laceration that penetrates the hoof capsule. So recently I actually saw 2 horses in different facilities that found the one sharp area of the metal pieces that held their door frame in place and managed to get their foot under that and then just cut into their hoof capsule with it. So it would be like in this area, they just cut a little chunk out of there. So obviously anytime that you're opening up that hoof capsule to bacteria, that's not a good thing. Another cause of abscessing can be incorrect nailing of horseshoes. So we all, like every farrier out there, wants to do the very best job that we can. We're not trying to, stick horses or anything. But we have a very small margin for error when we're nailing into a horse's foot. So statistically, if you drive enough nails, unfortunately, there will be one that's too close. So that obviously, again, it's a little cleaner than the nail that was on the ground that they're stepping on, but you're still introducing bacteria into the foot, and you're introducing a foreign object into the sensitive part of the foot. And then one that's a little less common, a hoof wall crack like this, where we end up with a little spot on the toe that's got a crack in it, or sometimes it'll be in the quarter. If it gets packed full of mud and manure and bacteria, sometimes it can basically be packing up higher and create pressure in there. And if you basically have bruising, and then we have that bacteria and that dirt, again, we're creating that perfect environment. So certainly if you have a horse that has a little toe crack like this, whenever your horse comes inside from being outside, just pick that out when you're picking out the rest of the foot. It's a pretty good preventative measure. So then our third cause is disease. So any hoof disease that causes tearing or rupturing of capillaries within the hoof capsule, again, is creating that bruising. So that's a prime source of food for that bacteria. And then also any hoof disease that weakens the protective horn layer of the foot can create a really easy access for that bacteria. So think of diseases where you have like a lot of stretching in the white line, or like white line disease where there is a missing chunk of hoof wall. Anything like that can create that opportunity. But we'll talk more about specific diseases that can cause repeated abscessing a little bit later in the talk today. So what are our symptoms? The classic symptoms for an abscess are rapidly escalating hoof pain, and it can often be extreme to the point where a horse is non-weight bearing. I have had a lot of clients that have had abscesses describe it as, we thought he had a broken leg. So first off, if you see your horse act like they have a broken leg, don't panic. It could just be an abscess. We typically see some heat. So that heat might just be in the hoof capsule itself, or it might continue up the leg a little bit. We typically see an increased pulse. So the pulse will be faster or more of a bounding pulse is how we describe it. So if you're taking their pulse, it would be a firmer pulse against your finger versus the regular strength, but we'll talk a little bit more about that in a minute. And then some things that you might see, but you might not see. Occasionally swelling will occur. So that would be just above the coronary band. You would start to see some swelling. Typically you wouldn't see that like first thing. Typically that would be more of a ongoing abscess that you might see that occur. Usually with a regular abscess that's just beginning, the swelling is all inside the hoof capsule, so you don't see it. And then you may see drainage as well. So if you see drainage, that's a really good thing, because that means that not only have you spotted the abscess, but the abscess is also already resolving. So if you see drainage coming out of anywhere, that's fantastic. You just skipped a bunch of steps. So again, swelling and drainage you may or may not see. So I wouldn't use those as necessarily diagnostics, but the rapidly escalating hoof pain, heat, and increased pulse would be your main symptoms. So we're going to talk really quick about how to check for heat and take a pulse, because it doesn't really do you any good if I tell you to check for heat and take a pulse if you don't have a standard way to do that. So when you're checking for heat, make sure you clean that foot off if it's dirty or covered in mud, but don't hose it off, because that's going to cool the foot down, obviously. And then use the back of your hand, just like if you're checking for a fever, or if you've ever seen, probably when you were a kid, your mom would check for fever like that. The back of your hand is more sensitive to heat than the front of your hand. And then check the opposite foot as well, because that's going to be your baseline. So that's going to be your normal temperature, and then the painful foot is going to be, is it different than that normal temperature or not? Because horses' feet will definitely change in temperature, just based on if you have your horse out exercising and they come in, their feet are going to be warmer. If you have the horse that's standing half in the sun and half in the shade, sometimes you'll get a warmer foot and a cooler foot. So you always want to check that baseline. And then as far as taking a pulse, you just want to have a very standard way to take a pulse, because if you're doing it differently every way, or if the first time that you check your horse's pulse is when they appear to be having an abscess, then you're just not going to know what normal is. So again, we're going to brush off any dirt or mud in the fetlock area this time. And then you're going to cup your finger and thumb around the back of the fetlock and press what's called the neurovascular bundle. So that's your vein, artery, and nerve against the sesamoid bones. And I'll have a picture here in a moment to show you exactly what I'm talking about. And then if you want to know how many beats per minute you have, set a stopwatch for 15 seconds and then count how many pulses you feel, and then multiply that by 4 for your beats per minute. And then again, compare it with the opposite foot. Is one foot more of a forceful pulse, or are they both pretty much the same? And again, this is something you want to practice before you have a problem, so you know what a normal pulse is for your horse, because just like with humans, with our blood pressure, our pulse, there's ranges, like a variation depending on how fit you are and your body. So we have, this is our neurovascular bundle. So what we're really checking is that artery, because that's where we're going to feel the pulse. But we also have the vein and the major nerve coming down there as well. And so right over this fetlock bone here, you can push that neurovascular bundle right against the bone, and that gives you a really good hard background to check that pulse. So what that looks like in real life, so you're just going to cup your finger and thumb around the back of the fetlock here, and then just gently squeeze, and you should be able to just feel that pulse. Some people also will check a pulse down here. That's fine too. Just whatever way you do it, do a standardized way. Some of these symptoms that we've been talking about, like raised pulse and heat and even swelling, are common to a lot of different problems. So just like when, COVID came around and they were like, you might be stuffed up, you might, have a sore throat. And a lot of us were saying, oh crap, like I have allergies, I always have those symptoms. How do I know the difference? So we're going to talk a little bit about how we can tell the difference between heat and swelling and, rapid increase in lameness. Those can all be symptoms of laminitis or a broken bone, or so how do we know what we're dealing with? So with an abscess, we typically see lameness and heat in one hoof. A lot of other causes, you're going to see that lameness and heat in 1, 2, or 4 feet. So there are some other things like a broken bone that could be in just 1 foot, but like laminitis is typically 2 or 4 feet. It's not typically just in 1 foot. With an abscess, we usually see rapidly escalating pain. So it starts out very mild and then it increases pretty drastically. With a lot of other causes, it tends to be more of a slow escalation, or it goes 0 to 60 and then stays there. So like with a broken bone, yes, that is a very rapid onset pain, but it typically stays about at that level. It doesn't continue to go up. Whereas with the abscess, we tend to have like rapid onset and then continue to get worse until it vents. With the swelling, with an abscess, if it is present, which again may or may not be, it begins at the coronary band and then travels upward in the leg as that infection continues. A lot of other causes, the swelling might start somewhere else in the leg and then it might go down, but it doesn't typically start at that hoof capsule and then move its way up. Abscesses don't improve with rest. So if you have if your horse comes in really lame, you put them in the stall and then they come out the next morning feeling good, it probably is not an abscess. The one thing that may give the lie to that is if you have what we call a close nail. So it's not a nail that's driven into sensitive structures, but it's a nail that's just a little bit too close. And so occasionally the horse will feel that pinch, but they don't feel it all the time. That will be a little bit better with rest than with when the horse is exercising, but it's not going to go away without treatment. So if you've gone through this checklist and you're pretty sure you're falling into this abscess category, what do you do next? The very first thing you need to do is your horse up to date on their tetanus shot. So a hoof abscess is one of the most common causes of tetanus infections in horses. especially those that involve injury or a foreign object. Um, so tetanus is a very, very severe issue, obviously. It has a 67% mortality rate in horses on average. This was from a study that was done in Europe between 2000 and 2014 on pretty much every horse that they had come in with tetanus. So the hoof abscesses was one of the top 3 causes. So make sure that your horse is up to date on their tetanus vaccinations. So moving on from that, who do we call when we have an abscess? Either person is a fine choice between a vet and a farrier, like they will both be able to be helpful. But there are some scenarios that lend more to one professional versus the other. So you should call the vet if your horse is not up to date on their tetanus, because they're going to need that sorted out anyway. So while the vet is out there giving the vaccination, they can also check on the abscess. If there's a foreign object or an injury present, that's definitely a sign for the vet. What we always say as farriers is like, if there's blood, it's a vet problem. If it is difficult to isolate the lameness to the hoof, so you're not positive that the lameness is in the hoof, it could also be, in the shoulder or the knee or whatever. That'd be more of a vet thing, where if it is one of those other areas, they'll be able to do a little more diagnostics for you. You should also call the vet if the horse appears to be having complications, such as colic or other stress-related issues. Some of your very sensitive horses, just the extreme pain and stress of the abscess can cause them to not want to drink their food, or not want to drink their water or eat their food. And so obviously that can be an issue. And then if the abscess is reoccurring or has been going on for some time without resolving, that would be a good time to call your vet as well. Again, they've got some diagnostics that they can use. They can administer antibiotics. There's some things that they can do that we as farriers can't. So you should call your farrier if the lameness is very obviously in the foot. So the foot is definitely our area of expertise. If the horse has recently been trimmed or shod, like when I'm saying recently, probably within the last 3 to 4 days. Or if the horse has recently pulled a shoe. Sometimes, like I said earlier, if there's a bad nail, it can be an easy fix. Just pull out that bad nail and you could be good to go. Why I say recently pulled a shoe, occasionally we have horses that pull a shoe and then twist it and step on it, and they can injure themselves that way. And so that would be a reasonable cause of an abscess. If the horse has an ongoing hoof pathology that your farrier has been working on, I'd at least call them and talk to them and say, like, it seems like we're having an abscess. Does this make sense with this overall issue we've been working on? And then if your regular farrier appointment is within the next day or 2, then just go ahead and keep that, and they may be able to open the abscess up for you then. Again, either the vet or the farrier is going to be a good option to call for an abscess. So we've got a few do's and don'ts while you've made that call to your professional, but typically they can't be out there immediately. So as far as things to do in the meantime, do call a professional. Again, like, there are some pretty severe side effects that can occur with an untreated abscess. We'll go into those later. But it is a good time to get someone else on board. If there is a foreign object in the foot, so if you see a nail, or even I've seen a piece of like wood mulch stuck into the foot, which you've got to hit that at just the right angle, don't pull it out. Take photos to record it, so as many angles as you can, and then protect the foot from further damage, which we'll talk about more in just a second. Regardless of whether there's a foreign object or if you're just seeing extreme lameness, thoroughly clean the hoof. Make sure you've picked it out really well. Soak the hoof in clean water and apply a wrap if necessary. So if there's anything that you see that might be sensitive, or you see a track that might, like a little black spot or something that might be an abscess, just wrap it to keep it clean. It's going to be really helpful for the vet or farrier when they come out to have a really clean foot to look at versus a dirty foot where they're not sure what they're seeing. And then don't administer pain medication without consulting your vet. So obviously you see your horse in extreme pain, you want to make it better, but it can be challenging for your vet or farrier to diagnose what the issue is. If you gave a bunch of bute before they got there and now the horse is feeling a lot better, it can be a tough deal. So talk to your vet. Obviously, there are circumstances where you really want to reduce the stress that your horse is under right now. So like we talked about earlier, the ones that colic really easily or something like that. It might be worth it to do the pain meds, but talk to your vet about it. Please don't pack the foot with magic cushion or other really sticky packing. If it looks like tar, please don't put it in the foot right now. It's really, really hard for us when we are trying to look for an abscess. We're looking for a very, very small black dot on your horse's foot. And if the whole thing is covered with something very dark and sticky, all of our tools, our chaps, our clothes, everything is going to be covered in it. And B, it's really, really hard to spot that one tiny little hole. So just hold off on that until after the vet or farrier has come to take a look at it. Please don't turn your horse out in mud. Again, going back to a clean foot is way easier to find that little tiny pinprick of a hole. And again, if there is a foreign object present, do not remove it without consulting your veterinarian. So with a foreign object, obviously that's, as soon as you see that nail head sticking out of your horse's foot, you know that that's a big deal. You know that could be a big issue. So what you're going to do first is record the foreign object by taking pictures from multiple angles. We all have our phones nowadays that we can take as many pictures as we want, so no excuse for holding out. Take a video, you know. Call your vet and then send them those pictures. They'll be wanting to know where that nail is and what angle it's going in at. Under this, if you happen to know where that nail came from, like let's say you just had your roof redone on your barn and you know what the roofing nails look like, you know, let's say you know that they used 2-inch nails or something like that. That would be helpful information at this point as well. And then you're going to wrap the foot to keep that object from penetrating further. So if you have, let's say you have a nail sticking out in the heel, you're going to want to, some people will use like a terry cloth towel, like a regular bath towel, and roll it up and basically make a donut that goes around where that nail is, and then duct tape that on really thoroughly. So you're basically lifting them up so they're not stepping on that nail anymore. Because obviously we don't want that to be pushing in any further if it does have that option. And then if your vet tells you to remove the object, make sure you mark the spot on the foot. So grab a Sharpie and just draw a big black line around where that nail is poking out, and then mark the object as well. So you want to be able to, once it's pulled out, know exactly how far in it went and know exactly where that hole is. You would be shocked, like especially if they're in the frog, a nail can really just disappear, like that hole can disappear once you pull that nail out. It just closes right back up, and then it's really hard to know where to treat. So definitely mark that. So why do we say don't pull the object out without calling your vet? Once this nail is pulled out, like if you can just see this nail head and you pull that nail out, it's really, really hard to tell what structures that nail might have affected. So a lot of times, if there is a chance that that nail went into sensitive tissue, your vet is going to want to take x-rays of it, and they're probably going to want to take multiple angles so that they can see exactly what structures that nail is affecting, how long it is, what angle it went in at, because you're going to have a very, very different treatment protocol between a nail that went in just to the solar corium versus a nail that punctured the deep flexor tendon and went into the navicular bone. So again, it's up to your vet. If they tell you, maybe they won't be able to be there for a few days or something like that. Well, hopefully they'll be able to be there sooner than that. But if they can't be there right away, they might tell you to remove it. But again, mark it, make sure you know exactly where it went in. And then once you've pulled it out, wrap the foot and keep it really clean until they can get there. And obviously follow any direction that they give you over the phone as well. So that's our foreign objects there. Moving on. We talked about soaking, and like everyone pretty much knows, like if you have an abscess, you soak the foot, right? So why do we soak? If the abscess has not drained yet, soaking can soften up the horn, and it possibly allows that easier escape for the trapped pus. If the abscess is sealed in by dirt or debris, then soaking might loosen that material, which allows, again, that pressure to release. So like a small abscess like this probably started out as just a little like folded over bar like that, and then stuff got underneath it. It created this, abscess here. But possibly that was just sealed up with dirt and manure and whatever else packs up in there. So it may be, if you pick out the foot really well, give it a soak, you might be able to release some of that dirt and let some of that pus start draining out, which is going to immediately improve your horse's comfort. If the abscess is already venting or draining, soaking it speeds up that process, because if you've seen abscess, let's say abscess goo, the pus that comes out of an abscess, sometimes it's quite thick. Sometimes it'll be thin and runny, but sometimes it'll be quite thick. And so adding some water to that can help let that flow out a little bit easier, and it can also help clean out that infected track. So when we're talking about soaking a hoof, there's a few steps to be successful at this, especially if your horse is maybe not super excited about the process. So the first thing you want to do is make sure to prep everything before you just grab a bucket and stick your horse's leg in it and hope for the best. So make sure you have a clean, level area to work in, preferably a wash rack if it's available, or somewhere close to where your water source is. Prepare your soaking materials. So you're going to want clean, warm water in a bucket or a feed pan, and then assemble your wrap materials, because once you're done soaking, you're going to wrap it. So we want to make sure you've got everything there so you can just flow smoothly from one step to the next. So you're going to want a diaper, vet wrap, duct tape, or elasticon. And then for the actual soak, you're going to bring your horse to where you've got your setup there. Encourage them to place their foot into the feed pan or bucket and then fill it with the water, or some horses prefer to step into a pre-filled pan if they're a little weirded out by the water flowing. And then if you can provide a distraction for your horse, like a hay net, if your horse loves to be brushed, like this would be a great time to give them a good brushing. Something to just help them stay still and calm. And then after about 15 to 30 minutes, remove that pan or bucket and immediately apply the diaper to the hoof, then do your vet wrap, and then finish it off with protective duct tape or elasticon. So you might be questioning, should I add Epsom salts to this mix? Traditionally, Epsom salts have been added to water for soaking. What you want to remember is that any salt, Epsom salts included, has a drying effect. So during the initial soak, we're trying to soften the hoof so that pus can escape. So drying the hoof with the salt is probably not the best move at this point. But once the abscess is opened and you're soaking to clean out and encourage draining, that would probably be the better time to add the Epsom salts to help reduce that inflammation, just help everything calm down a little bit. And then some of you might be questioning, like, Epsom salts or no Epsom salts, my horse is not going to stand in a bucket. Like, that's just not my horse. So we've got some options, some alternatives. Soaking boots are a really good alternative. It's a good choice if your horse isn't spooky, but just like wants to flip over the bucket all the time, or just walks around a little bit, doesn't want to stand in it. Some of the really more playful horses that just decide that it's a really fun game to flip over the pan and watch you have to refill it a million times. This can be a good alternative for them. So you fit a sturdy waterproof boot to the hoof and then fill it with warm water and secure. So there are purpose-made soaking boots that you can buy. Some of them can get fairly expensive, but there's a few other options if that's not in your budget or that's not something you normally would use. So a really thick IV bag is a good option. You want the big ones because it needs to go up completely over the hoof capsule and then have enough left over to duct tape it closed. But IV bags are made of like a really sturdy plastic. So your vet can provide these. My guess would be you can probably find them on Amazon, honestly. But so you basically are going to get an IV bag, you cut off the top, and then you basically just have a thick, sturdy plastic boot that you can put on there, fill it up with your water, and then duct tape the top closed. If you don't have access to an IV bag, those plasticky feed bags are a great option for this. I can't take credit for this. I saw a client do it, and I thought it was a fantastic idea because it was what she had available on that day when the horse had the abscess, and she figured it out. So those thick plastic feed bags, just cut it off at an appropriate height for your horse's leg, and then fill it with water, duct tape it closed. So if your horse is probably not going to handle having a bag taped to their leg, you can try an animal Lintex pad. So it is basically a poultice pad. Again, you can find these pretty much anywhere. Amazon, Valley Vet, like any of the big online suppliers have them. And it's basically, it looks like a piece of cotton with a little plastic back. So you cut it out to wherever you want to fit on the foot. So if you know a specific spot that you think that the abscess is, just cut out an area small or big enough to cover that area. If you don't know where it is, then you would cut out a hoof-sized or hoof-shaped chunk of it and put it on there. So you're going to take that pad, you're going to get it wet, and then you're going to put it over the area, and then you're just going to wrap it. So again, you want to build a nice sturdy wrap. So you're probably going to throw a diaper over that, and then vet wrap, and then duct tape or elastic on. So what is next after that? Once your farrier or your vet arrives, they will probably use hoof testers to try to localize the abscess. So that's what we've got going on here. So basically with the hoof testers, you're just gently squeezing all the way around the foot, and over the area of the abscess, they will typically just give a little pull with their foot. If they're very painful, they might try to jump a little bit, but it gives you a localized area to look in for that. So once they know the probable location, then they'll look for any little, like we were talking about earlier, a little black dot, a little suspicious looking area, and then they'll try to open that up and allow the hoof to, or allow that abscess to drain. So typically we open those abscesses up from the ground surface. I have occasionally seen some farriers or vets that will open it up a little bit higher if they know exactly where it is and it's already traveling up. Personally, for me, I would rather just have a little hole on the bottom of the foot than have a hole up here that has to grow all the way out, but whatever's necessary at the time, I guess. So once the abscess is draining, that's the moment when your horse is starting to get some relief. So if it all goes well, the farrier or the vet will be able to localize the area of the abscess, then they'll use a hoof knife to open up a very small drainage tract. A lot of times this will be the original area that was the entry point of the bacteria. So if they stepped on something and there's a little crevice there, like that's probably where they will open up to allow drainage, because that's usually, since that was where the abscess started, it's going to be kind of the central point of that abscess. We try to make as small a hole as possible that's going to still allow drainage, because again, this hoof capsule here, this is the protective structure of your horse's foot. They have a coffin bone inside there, they have sensitive structures inside there. So we're not trying to make a giant hole that's going to expose those sensitive structures for any longer than they need to be exposed. So then the gas and pus will escape through this hole, and typically that is instant relief for your horse. They won't necessarily be 100% as soon as that drains, because they do still have that inflammation inside the hoof and just all that irritation. But you should go from, being 5 out of 5 lame to maybe being like a 2 out of 5 or even a 1. So it should be pretty immediate relief. And when we talk about, sorry, going the wrong way there. When we talk about draining an abscess, it can drain all different color pus. Sorry if this is a little gross for people, but so you can get a tannish color like this, you can get black, you can get gray, you can even get like a clearish one. If it is related to a very large abscess, you might get some blood in it, but you shouldn't get just straight blood. It should be pus rather than blood. Okay, moving on from pus. So if some abscesses might not be found and drained through the sole, so in that case, you would continue to soak, and the abscess will vent naturally once it reaches the coronary band. So that's what this line here is. So basically, if the bacteria is introduced here, it just works its way all the way up until it reaches sensitive tissue here, the coronary band, and it just pops out between that hoof wall and the coronary band. When that occurs, you might see some pus leaking from a small crack at the hairline, and you should see a noticeable improvement in soundness. Sometimes, depending on when this happens and where the horse is when it happens, you may not actually see the fluid, but you might notice that your horse seems to be feeling better, and then when you look really closely, you might see that little crack area. So that little where it vents is always going to be parallel with the coronary band here. So venting from the coronary band, well, it's the natural way that an abscess blows out. It is slower than opening it up from the bottom, and it does create more damage to the hoof. So when we talk about that abscess working its way all the way up through there, the lamina that's in this area is going to be damaged when that happens. So you will have a hollow spot under the hoof wall wherever your abscess traveled. So obviously that's not ideal. We don't want hollow spots in the hoof wall. So whenever possible, they should be drained from the bottom, but occasionally there's one that just doesn't work that way. So what happens if it's not treated? Like we said, best case scenario, it vents through the coronary band and you just have a damaged area of hoof wall that's going to have to grow out. But if the abscess goes on for too long, it can create long-term and even life-threatening side effects. So we can get extreme pain and stress, which can lead to colic, as we talked about, in sensitive horses. You can have a bone infection if you just have an ongoing abscess that's not draining. It can even reach the coffin joint, which obviously once you get a coffin joint infection, you can get arthritis. It can have a very long-term effect on your horse. Some horses have even developed sepsis from very long ongoing abscesses. And then, as we talked about earlier, tetanus is a big concern. So for those reasons, we definitely want to get professionals involved when we have an abscess occurring, and don't put it off. Don't think like, oh, it'll just drain on its own, it'll be fine. Definitely look for that help. So post-abscess care, once the abscess vents, whether that's through the coronary band or through a hole that somebody cuts in the bottom of the hoof, you'll want to soak it at least one more time, preferably several times, to just ensure that that abscess tract is completely drained and clean, especially if you have a large abscess tract. So if you have a subsolar abscess that's just, half the hoof, half of the sole is undermined, it's going to take a little while to clean all of that out. Or if you have an abscess that traveled all the way up the hoof wall, again, that's just a larger area. So we want to make sure that we get that nice and clean. Keep the hoof as clean as possible until the pain is resolved and the abscess area feels firm to the touch. So initially, it might feel, where they opened up might feel a little squishy, might feel a little soft. So you want to make sure that that's kept nice and clean until it's hardened up and had a chance to make that protective layer again. And then if lameness reoccurs, pick out that hoof really thoroughly and then soak it again. Sometimes if you have a big abscess tract, it can seal up with dirt and debris and just make a little pocket and start again in there. So if your horse, were to go lame again in the aftermath of an abscess, you would definitely want to assume that it's probably the same spot. It probably just got some stuff up in there, especially if where they go out, is necessarily wet or muddy, or if they're that horse that just wants to stand in every puddle they see. So I would recommend just soaking that again if you see that recurring lameness. Subsolar abscesses typically don't require special shoeing or trimming. So again, subsolar being the abscesses that are completely under the sole, not going up the hoof wall. The abscess tract typically will trim out within 2 to 3 hoof care cycles. And then in rare cases where the abscess was really severe and compromised a large portion of the sole, you might need some kind of protective shoeing package just to give them a little bit of extra protection, since that sole is not doing its job protecting the coffin bone very well. So this would be the most severe option here. This is called a hospital plate. So basically there's a shoe underneath this, and then There's drilled and tapped holes and bolts that go, this is just a metal plate that fits to the shoe. So you can put the metal plate on and then pop it off and treat underneath it and then put it back on for protection. But a lot of times just even adding just a regular pad can do the trick once everything's, clean and dry. You wouldn't want to put a pad on right away while that was still draining or still questionable at all. You want to make sure it's nice and clean and dry so you're not sealing anything up in there. But otherwise, just a little bit of protection can be helpful. Although again, a lot of horses don't even need the addition of a pad or anything. Submural abscesses are, again, ones that go up behind the hoof wall. They typically also don't require any specialized trimming or shoeing. If the abscess vented from the coronary band, it's going to take about a year for that horizontal crack to grow out. So get used to seeing it. It's going to be there for a little bit. And then when that weakened area nears the ground, it might break out or it might cause challenges as far as nailing the shoe on if it's in the area where the nails would normally go. But it's usually something that can be worked around. So this diagram just shows how that abscess track, where it's initially going to blow out at the coronary band, and then as it grows down, you'll watch that little crack just move its way down the hoof wall. So basically anything from here down is undermined, and you know that. And typically the size of that crack will show you how wide it goes. And a lot of times it's just, an inch or so. It's not usually too extreme. Sometimes you'll get bigger ones, but whereas with a subsolar abscess, you're only growing out this much sole. So if we have a pocket here, it's going to be gone within 1 or 2 trimming cycles. If we have a line up here, it's going to take a long time for it to grow out. So these are some examples of what it looks like when that abscess is growing out. So this one's a little bit abnormal. My assumption would be that when this horse had the abscess, it did something to irritate its coronary band. So whether that was just the way that abscess blew out was just very traumatic to it, or if there was something else involved, I don't know. But it did grow out with this large lump of horn right underneath that crack. And it grew out just fine. Most of it was able to be rasped off pretty shortly after this picture was taken. But you might see some abnormal horn production right around that area. This is a lot more typical, where you just see a very small crack like that, and then a very small crack like this. So this one had 2 separate abscesses, probably 5 to 6 months apart, I would guess, because we're about halfway down the hoof wall. But that would be pretty typical for what you would see, just a little vertical line there. Again, this would be a pretty typical one, just a little line. It's basically parallel with the coronary band. So that tells you that it is an abscess blowout and not a quarter crack or what we would typically define as cracks in the hoof, which would tend to be more vertical. So this was a fairly large abscess when it was originally up at the coronary band. You can see that crack kind of starts there and goes all the way around to there. And then as it got close to the ground, this area here broke out. So you can see where this foot would be hard to nail a shoe on, but you could punch some nail holes back here. You could throw a nail hole up there. It would be doable. One thing that you can kind of look at if you see a broken out area like this and you're not sure whether that was an abscess or not, is if this area here right at the top of it is like basically a smooth, almost cupped shape, that tells you that it was basically an interruption in the growth. So when that abscess breaks out, it interrupts the hoof growth that's coming out of that coronary band. And then once it's blown through, then it just resumes growth. So you basically this is basically just an interruption in growth. Whereas a normal, like if a horse just broke out a chunk of its foot hair, you would see a very ragged edge typically. You would not see like a smooth, clean edge on the top. So that can just be a clue if you're not sure what you're looking at. Maybe it's a new horse to you or something like that. So what can we do to prevent abscesses? This is just something we have to deal with, something that happens. Certainly there are a few abscesses that no one could predict and you can't prevent, but there are a lot of things that we can do to change that course. So going right back to our 3 causes that we talked about earlier, that's going to be our 3 categories of prevention. So again, we have environmental, injury, and disease. So when we're talking about prevention from environmental causes, if it's possible, don't turn your horses out in really deep mud, which unfortunately in some areas mud is just a fact of life, but working on improving drainage can be helpful. Maybe it's something where it's time to put in that limestone paddock, If you know that a hard freeze is coming and your horse is out in something like this, some people will take the horses in, flatten that area out with the back of a shovel or something, and then once it freezes, it's not going to be as ridgy. Still going to be hard, but it won't be as ridgy. So that would work well if you have just a small area that gets quite muddy, like right next to the gate or next to a water trough or something like that. And again, if you know that there is going to be a hard freeze, maybe that's the time to throw a pair of hoof boots on if your horse is barefoot. Just add a little extra protection. Keeping stalls clean and just picking up manure and turnouts when possible. It's just going to reduce the amount of bacteria that their feet are being subjected to. Talk to your farrier about adding pads maybe if your horse is going to a really rocky area. If your horse is barefoot and you want to keep them that way, talk about what kind of boots can we use. There are ways to protect your horse's feet no matter whether you want to go shoes, boots, whatever. Fly boots can be really helpful as far as that horse that's just standing there stomping flies all day. If you throw those fly boots on, it's just going to really reduce the amount of concussion that foot is going through. So again, reducing bruising, which is one of our big risks for an abscess. And then some horses just might need to wear shoes or boots. Like some horses just have really thin soles or very flat feet, and they just might need that little bit of extra help. Which again, like I'm a farrier, I put shoes on. I also have a lot of horses on my books that are barefoot, and I would love it if every horse on my books could be barefoot. That would be great. But some horses just need a little extra help one way or another. So preventing injuries, definitely pick up any debris that you notice in horse areas, because we know that horses just look for things to hurt themselves on half the time. So if you see, even things that you don't necessarily think they could hurt themselves on, but you're not sure, like just assume that they will and take it out of their area. If you notice they have any broken fence or damage in a stall, repair it right away or block that area off. Don't use that stall, whatever you've got to do, because all it takes is a few nails hanging out of a fence board or, that sharp edge on the bottom of the metal that's rusted off. Metal fences or metal, gates. Metal gates is the word I'm looking for. Metal gates where like the bottom of the rail is really rusty and, starting to fall apart. Like that can be a big spot where if they're banging on the gate to try to come in and they get their foot under there, they can do a lot of damage pretty quickly. And then if you have had construction done, whether that's like building fences or getting a new roof on your barn, go out there with a magnet and look for stray nails when the project is complete. I cannot tell you how many nails I have found on the ground around barns after a roofing project or something like that. One of the horses that I've seen that had a nail in their foot, it was immediately following a roofing project. I know that if you have, a craftsman that cares about their job and everything, they're going to do the best they can, but nobody cares about your animal as much as you do. So make sure that ultimately you're taking responsibility for just checking, especially if you have like a paddock area or something that's right next to the barn, like just go out there with a magnet and check it. You can get a rolling magnet about, a foot wide, can make the job really easy. You can grab those at Menards or Lowe's or anything like that. Better safe than sorry, And then when we're talking about disease, if your horse is experiencing repeated abscessing or an abscess that refuses to clear up despite treatment, do contact your vet, because this is a sign that something is going on internally. That is not normal to just have a horse that's, constantly abscessing. Many of the conditions that cause repeated abscessing are treatable, so don't put it off out of fear, like I don't want to know what this terrible thing is that's causing this problem. Some of the solutions are fairly simple. So laminitis is probably one of the scarier ones. It is a relatively common cause of repeated abscessing. The abscessing in a laminate, of course, is caused by the coffin bone rotating. So again, where we go back to our anatomy that we talked about at the beginning, we have that lamina that's attaching the coffin bone to the hoof wall, and laminitis that's affected and damaged. So all of those little blood vessels in there can be tearing. And then if the coffin bone is destabilized, there's blood vessels in that solar corium as well that might be getting crushed by that coffin bone descending. So it creates a really distinctive abscess pattern. So typically you will see like this, where it just follows right along that shape of that coffin bone in the front half of that foot. So you typically won't see it like back in the heels. It won't typically be like in the bars. It'll typically be like a real sad smiley face right here in the front of the foot. Laminitis is usually treatable. It does require a team approach. It does require a lot of effort on everyone's part. So again, you do want to get your vet, your farrier, everyone on board, and make a plan. But again, don't put it off out of fear, because if you let it go untreated, you're definitely going to have more issues. If you treat it, you might be able to resolve the issue and move on with a happy, healthy horse. Laminitis is obviously its own whole huge topic that we could do a whole talk on. But for the purposes of abscessing, that's what we'd be dealing with. And again, you would want to treat this abscess the same way that you would treat just a normal abscess that's not coming from a disease cause, where we would want to be soaking it. You would want someone to come open up that abscess and let it drain, and then making sure that it's really clean. So a keratoma is a less common cause of repeated abscessing, but I've probably seen 4 or 5 of these in my career at this point. So they do happen. So a keratoma is a keratin-based tumor that forms on the inside of the hoof wall, or occasionally under the sole. So this is actually the inside of our hoof wall that we're looking at. This is a keratoma that's been surgically removed. So you can see this big lump here. And so that is going to be constantly growing, which puts pressure on the coffin bone and the sensitive foot structures inside that hoof capsule. So that can cause abscessing alone. You can also get abscessing just from the fact that you have this tumor that's growing down, and once you get to the white line and the sole, it just doesn't seal to them well because it's not supposed to be there. So you basically have a little tiny crack that goes around it in some horses on the solar surface of the foot, and it's very prone and vulnerable to getting just manure and dirt and bacteria just up in there. So that can obviously cause a problem. So if your horse is repeatedly abscessing in the same hoof and in the same spot in that hoof, a keratoma could be the culprit. So it's not going to be, if your horse has a lot of abscesses in one foot and they're in all different areas, that's not a keratoma. Because again, this problem is really localized to where that tumor is. So your vet will diagnose a keratoma via radiographs. So they're basically going to take a x-ray of the coffin bone, and if that keratoma has gotten large enough to push into that coffin bone, you will see an indent in the coffin bone. So what you're basically looking for is missing bone. We can't actually x-ray, you can't really see a keratoma itself on an x-ray because it is made out of horn. So obviously x-rays pick up bone and not horn. So you're basically looking for missing material in the coffin bone that's caused by that keratoma. As far as treatment goes, one thing that can help if you are getting a lot of abscessing just based on this little crack around the bottom of the keratoma and not based on the pressure, sometimes just adding a shoe with a pad can help, because it's just keeping outside materials from getting into that, just being a little protective layer. If the abscessing is caused by that pressure on the bone there, then you're looking more at surgery to remove it, which is definitely a process, because again, you're removing a piece of horn from top to bottom typically. So it is going to take around a year to grow out, and you will need to take it somewhere for surgery. It's not something that can be done at your barn. But there are really good teams that can do this. It's not an uncommon surgery for a, let's say like a lot of the vet schools or, the big practices will see these fairly commonly. But again, an abscess that's caused by a keratoma, you're just going to treat as a normal abscess at the time. The only difference is you probably know where it is. So whereas on a normal abscess, we are trying to locate where that is, and you may not know where it is in the hoof capsule that the pain is coming from. With a keratoma, we pretty much have the usual suspect right there. So that's where you're going to go to as far as checking for pain, checking for drainage, everything like that. So in that way, it can make it a little easier. So some other diseases that can cause repeated abscessing. If a foreign body is lodged inside the hoof, so let's say that you had that horse that stepped on a piece of mulch and it punctured into the foot, and a piece of that wood stayed in there when you pulled the giant chunk of mulch out, that little piece in there can fester. So that can cause irritation and abscessing as it tries to work its way out. If you have a bone chip, so let's say a small chunk fractured off of the coffin bone at some point, and that's just sort of free floating in there, that can cause a lot of pain and irritation and eventually abscessing. Again, the body is trying to get rid of that. So sometimes those bone chips might reabsorb, but sometimes they cause a lot of pain and just end up needing to be removed. So a really rare one, but one that I've seen on one occasion, was an autoimmune disorder. So I don't know that it makes it any more likely for the horse to get an abscess, but once they get the abscess, it doesn't want to heal because the horse's immune system is not particularly doing its job very well. So that one's a little tricky. That would definitely have to be diagnosed by a vet. And honestly, that one's above my pay grade, so I don't know what type of tests they do to ascertain if that might be the issue. But if you seem to have a abscess that you found, you drained, you soaked, you did all this stuff, and it doesn't seem to be clearing up, it's a possibility. I mean, I don't know how common this one is. I've only seen it one time, but it's something that exists. And then finally, a bone infection can definitely cause chronic abscessing and pain. So if the coffin bone is infected for one reason or another, and maybe it was a former abscess that got some infection into the bone and then that's just been festering, or sometimes it can just be from a lot of concussion. So you'll see it occasionally in a horse that, let's say, works at speed on concrete. So like a buggy horse or a horse that is ridden on really hard footing a lot. Sometimes you can see like a case of pedal osteitis, so inflammation of the coffin bone, develop into an infection. And that, again, is going to be something that you're going to need vet help for. They'll probably do a pretty good course of antibiotics. They might do what's called a regional limb perfusion, which is where they essentially put a bunch of antibiotics into the limb in that area and then let that sort of soak and flush in that area, and then they'll basically have it have that area of the limb cut off, and then they'll just not cut off physically, like cut off with a tight wrap so that that antibiotic just stays in there for a little bit, and then they'll take that wrap off and let it go out into the body. So how can you prepare ahead of time? Obviously, before something bad happens is when you want to be ready for it. Don't be like the person that, checks to see if their canned food is all expired after the terrible thing happens and they're stuck in a hurricane or whatever. So you want to prepare beforehand. So practice soaking with your horse. If your horse is not, let's say, the champion soaker of the world, just go ahead and next time you're giving them a bath or something, just grab a pan, throw it on the ground. Here, you have to step in this. Like, some horses are just really concerned about, am I going to get in trouble for stepping in this thing? Is it solid? I don't understand what it is. So just giving them that chance to get comfortable with it and sort of see it and do it in a situation where they're not in pain and you're not stressed. That can be a really good deal. And again, you know what your horse likes. If they're really treat motivated, you can go ahead and, give them some tasty treats during this time. Those horse licks, it's like basically a giant hard candy that's in a little tub, so they can just sit there and lick it, but they can't actually like just crunch it up and eat it. That can be a really good like distraction reward kind of thing. Um, and then practice checking your horse's pulse and the hoof temperature so you know what normal feels like for your horse. As far as hoof temperature goes, I would personally check when you bring your horse in and you're, giving them a grooming, and then check again after you've ridden and see, is it warmer now? Because if you have a really mild abscess, you may not notice it until you get on their back and then you've added weight to that scenario and you've asked them to move and then you're like, oh, something's not right. So then if you hop off and check it, it might be a little bit warmer anyway, just because you've asked them to exercise. So find out what normal feels like when they're not exercising and then after they've exercised. And again, checking your horse's pulse, just practice so you can find that artery every time. Because once this happens, you're going to be a little bit nervous. You're going to be a little concerned about what's going on. So it's going to be a little bit harder to do it smoothly and easily. So just practice it ahead of time, and then it'll be nice and easy and natural. Your horse will know what's going on. And then make sure you have supplies for making a nice hoof wrap. So have your like a baby diaper, at least one roll of vet wrap, a roll of duct tape or elasticon. Put those in a safe place where you're not going to use them for something else, like have a emergency only area in your tack trunk or whatever. And then a pair of bandage scissors can be really helpful if you're having to do repeated wraps. So if you haven't seen bandage scissors, they just have a blunt end that goes against the patient basically. So you don't have to worry about sticking that sharp edge of the scissors down into that wrap. You've got like a nice blunted end on there. So that can really make your life a little bit easier if doing a couple wraps is going to be in your future. But again, just having those things prepared is going to make everything calmer and smoother for you if you do need them. Making sure if your horse is at a boarding facility or someone else looks after your horse, making sure that they have your phone number and then emergency phone numbers like your vet and farrier. So if something happens, they know who to call, that they can get in touch with you, have it written clearly on your horse's stall, whatever you have to do. But just making sure that you've got everything in place that you can is going to make everything go a lot smoother if the worst does happen. So thank you very much. Thanks to HAHS for putting this together, and thank you for listening. I know time is our most valuable resource, so I appreciate the time that you all spent here with me today. Does anyone have any questions?
We do have one from Tammy, and Tammy, you can feel free to unmute yourself and ask, or I can read it. Totally up to you. I'll give you a second. Okay. Tammy asks, once a subsolar abscess has a hole and starts draining in the sole, is it now considered to be a puncture wound? And how long does it need to be covered so dirt and debris don't get in and possibly reinfect it?
That is a really good question. So it would not be considered a puncture wound if we're defining, here's this type of injury, here's this type of injury. But there is going to be a lot of similarities in the way that you're going to treat it and protect it going forward. So depending on the severity of the abscess, you may have sensitive tissue that is exposed in that hole, or you may basically have a relatively firm layer in there. But either way, you are going to want to keep it clean and as dry as possible once you're done soaking. Obviously, soaking, you're going to get it wet, but keeping it clean. Making sure the debris doesn't go in there is going to be a really big factor. So I would say you definitely want to keep it clean until the pain has resolved completely. So I would continue to soak it if the pain is not resolved to make sure that you're just getting everything flushed out of there, and then wrap it after you're done soaking. The horse can be turned out at this point. You're just going to have to do a really good wrap on there. So making sure that you get like multiple layers of duct tape on there protectively is going to be a big factor in that. Honestly, that like Gorilla tape that's super thick and strong, that can be really good for that. But yeah, I would keep it wrapped at least until the pain has resolved. And then once you've stopped soaking, that's going to start hardening up. And you'll be able to see like pretty rapidly, especially if we're having, dry weather like we've had a lot of recently, that horn will become firm and hard again. So then I would say you would certainly want to make sure when you're picking the foot out that you pay attention to that spot and like gently but thoroughly clean it. Um, and then you're probably fine once that pain has resolved and the foot is starting to feel like firm in that area, to just let them go out as they normally would. You'll just make sure you clean that foot, and then were lameness to start again, you would just want to go ahead and clean that spot really good and soak it really well. Does that make sense? Does that answer your question?
Yes, it does. Thank you so much. We
Oh,
have
yeah, no
another
problem.
question from Joanne,
Awesome.
and she did ask earlier, where are we checking for heat on the hoof or the pastern or
Hmm.
above the pastern? You had that great slide, and I think we might have answered that for her. But if we
Let
didn't,
me
Joanne,
cover that really quick just to make sure that we got the right answer. So you're checking for your pulse up at the fetlock, but you're checking for heat in the hoof capsule. So I would be checking for heat basically heel to heel in that hoof capsule, because
so
you're just
sort of
trying to localize where it might be.
excellent. So sort of feeling maybe, you know, clockwise around the hoof just to see if there's an
Yeah,
area
that's a
that's a
great
little
plan to
warmer.
have like have a direction you go and just have a system. I'm all about the systems.
Right, because if you have a system and you do it consistently, something that's out of the norm will pop right out.
It'll pop right out. Yep, absolutely.
Wonderful. So Joanne does ask, how long can it take for an abscess to move up to the coronary band? She has a horse that they've been treating as an abscess for about 3 weeks with some improvement, but unfortunately is still real sensitive on the foot.
Okay. So I have seen a pretty wide variance in how long that can take. And it kind of depends on how quickly this abscess is escalating, because as the pain escalates, that's basically indicating that you're getting more and more pressure inside that hoof capsule. So more pressure means that it's going to move faster. So if you have the horse that's kind of like just barely seems like they're abscessing, it's going to take longer, which is really frustrating because you're just like, just get it over with. Like, let's go. Um, if you have the horse that's in quite a lot of pain and it's really like, it really seems like there's a lot of pressure in there, those statistically are going to go faster. 3 weeks is kind of a long time. Um, if there's sort of some variation where like occasionally it gets better and then it gets worse, and I'm assuming that when they say treating like an abscess, that she's doing soaking. Um, you might be basically, when it gets a little bit better, there might be a little tiny bit of drainage that's occurring from, let's say, the bottom of the foot. If there was a very small tract that you may not even really see or notice. Um, and then as that is, like, it drains a little bit, he feels a little bit better, and then it seals up again, and then it starts to get worse again. So that's going to really slow down that progress because it's not really pushing its way towards the top. It's not really like creating that pressure that's going to move it along. Um, but obviously, we would rather it can just drain out of the bottom completely if you can. So one thing that I would suggest trying, and again, I'm not your vet or farrier, so I don't know all the details of the situation. But one thing that might be helpful is, um, after you soak, take a either a piece of like white cotton, or if you can get those animal latex pads, I think that'll be really helpful, and put it on the bottom of the foot. And then when you pull that wrap off, give it, I don't know how hard your horse is on wraps, but if whatever the normal limit is for keeping a wrap on, a little bit before then, so you still have like a nice sealed up wrap, take that off and see if you see a spot on that nice white clean pad. You might see a spot with just a little bit of discoloration, and that might give you a clue as to where it is. And those pads are also really good at helping pull stuff out a little bit. But knowing where that is might be helpful as far as, allowing your vet or farrier to make a little bit of a larger drainage tract. Because it kind of sounds like it might be just like barely draining a little bit and then sealing back up, which when you have a really small tract, that can happen. Hopefully that's helpful.
That is. Thank you so much. Joanne, is there anything we can follow up on for that? Okay, did anyone have any? And Joanne says they are doing everything you suggested. I do like your idea of putting a pad on there to maybe just get a clue as to where in the hoof.
Yeah, it can be really frustrating when you don't know where it is or what's happening.
Excellent. Did anyone have any other questions, or maybe just a hoof question in general, as long as we have an accomplished farrier with us this morning?
Oh man, putting the standard so high.
Do you want to? I'm going to steal back the presentation.
Yeah, let me see if I can hand this back to you.
Wonderful.
All right, you should have it.
Oh, excellent. And let's see if we can get mine to cooperate this morning. Ha ha.
Oh, technology, how we love you.
Right, exactly.
There we go.
So hopefully everyone can see the question slide. So we've sort of covered that, and feel free to jump in on us if you think of something. But this is Heather's. Are we seeing Heather's contact information?
I am just seeing the question slide still.
Oh my goodness. Computers are being super pokey this morning. We will hope that they catch up with us. But anyway, if not, we will also post this in our Facebook event. It is the website where you can find Heather's wonderful contact information, her articles that she has written for the American Farriers website, her email address, and of course her Facebook page. There's also a picture of her book, so you can easily find it on Amazon if you are interested. And hopefully we're moving along. So we do have a fun question that we like to ask all of our speakers. What was your favorite book as a child? Or one that perhaps inspired you to...
I am a huge book nerd, so yeah, I read like all of the horse books I could get my hands on. Probably my favorite, because I really liked the Narnia books, so the Horse and His Boy, which is like all about this talking horse, and like the kid escapes from slavery with this talking horse, and like they go on this adventure. That was probably one of my favorites. But pretty much any book with a horse in it, I was 100% on board with.
Excellent. That's wonderful. And then I'm just so curious about the additional certification that you earned this year from the Worshipful Company of Farriers. And I'm hoping you could tell us a little bit, just real super briefly, how you found out about it and what was involved in it. Because it's very impressive that you have it.
Well, thank you. So I found out about it initially. The farrier that I apprenticed with when I got out of shoeing school was starting the process of working on it. And he had a lot of friends that were farriers over in England. We have an exchange program, which I was able to go on, which is basically we send a few farriers a year over to the UK, and they send a few farriers over here, and you just stay with like different farriers and go to work with them and just learn all about it. So he was in charge of that program. So he had a lot of contacts over there, and this was something that a lot of them were working on or had already done. So that was kind of my introduction to it, was that it was like this really cool thing that like all these, cool British farriers were doing that I had a lot of respect for. And then I ended up doing an internship at the vet school at Virginia Tech. And so their farrier that I was working for, he had just passed the AWCF test. So I was kind of at that point like reintroduced to the whole process. But it's a really good next step. It, like you were saying with the description of how it, like all the things we had to do, it really tests like every aspect of your skills as a farrier. Like some of the oral tests will be like one of them, you go up, one of the examiners was there with a horse, and he was like, I want to buy this horse for my daughter to ride, should I or shouldn't I? And then you have to just go through an entire assessment of the horse. And like, but you also have to know to ask them questions like, how old is your daughter? What sport does she want to do? Is she like, this is her first pony and she just wants to like sort of amble around a field? Or is she like an accomplished eventer that's going to be, doing 3-day events? So it really tests like every aspect of not just your skill set, but also your ability to think on your feet and ask the right questions. And they ask questions about like professionalism and ethics and all sorts of fun stuff. So it was really, I mostly did it because I wanted to improve my skill set in as many areas as I could, and improve those areas that were the weaker areas that I would probably avoid if I didn't have a test to take or somebody that was going to ask me questions about it. So.
Right. That is fascinating. And thank you so much for bringing that credentialing and that level of competency to your work and having it available here in Northern Illinois for those of our attendees who are local. Are there any additional resources you would like to share with us? I know we had spoken, and we'll put that slide up for one, but anything you'd like to share with our attendees?
Yeah, so one thing I would recommend is if you're interested in, more stuff about hooves and everything, there's a really good book that I honestly use a lot called Understanding the Horse's Feet, and that's by John Stewart. And that one's written for horse owners. There's a lot in there for farriers and vets as well, but that's a really good one. Like I said, I'm a book nerd, so I can recommend all the books. But and then like we were talking about those Paige Puss and Jenny Edwards, her books. Those are really good if you're interested more in anatomy. If you kind of like some of the more case studies and like seeing a horse's foot with some really wonky problems and then what was done to help it, if you go on the American Farriers Association website, which is americanfarriers.org, you can check out the most recent issue of our magazine. And a lot of times we'll have like case studies in it, or, interesting pathologies and stuff like that. But yeah, there's a lot of good resources out there and a lot of fun books to read. So
Wonderful. We will post links to those in our episode summary on this episode, which when it's posted on YouTube, as well as on the Facebook event. So we are working on a speaker for next month. Everyone's summer schedules have made it a little challenging, but do keep an eye out and stay tuned to find out who our speaker will be in August. Hopefully you are seeing our upcoming events slide right now. We do have a few coming up for those who are physically near us in Northern Illinois. This Friday, HAHS has been inviting young readers through the Woodstock Library to come and read to the horses and the pigs. And they've really enjoyed it. The next event is this Friday from 11 to noon. And you can contact the Woodstock Library if perhaps you have some kids that would enjoy coming out and doing that. This Saturday is the first annual brewery bingo benefit, also in Woodstock at Kishwaukee Brewing Company. That is from 2 to 6, and it is family friendly. And finally, the Fall Festival, which is the annual picnic and open house, will be Saturday, September 16th from 10 a.m. to 3 p.m. Hopefully the slide is up and you can see what our handles are on all of our social media channels. You can always visit our website at hahs.org/events to get our full calendar. And then finally, just a reminder that all of our seminar series episodes are recorded and may be found on the HAHS YouTube channel. You can search the ID that's hopefully coming up on the slide at Hooved Animal Humane Society 1454 is the channel name. Or you can search Hooved Animal Humane Society and be sure you see the tree and horse logo. There are 15 episodes plus today's in our library that is perfect for rainy days or perhaps to just listen to while doing barn chores. A year ago, we talked to Dr. Emma Camps about tips for first-time goat owners. Please be sure to subscribe so you get a notification when this episode gets uploaded, and we hope you'll share it with anyone who could not make it this morning or in the future. If you have a friend or a barn mate that perhaps is having some hoof abscess challenges, we encourage you to share this resource. If you haven't already, please like and follow the Hooved Animal Humane Society on Facebook so you get all of our latest posts and updates on the adorable animals on the farm. Heather, thank you very much for joining us today to discuss hoof abscesses, and we hope you will come back in the future to discuss other specialty hoof-related topics.
Thank you so much for having me. This was great.
If anyone has ideas for future topics for our webinars, please feel free to reply to the email you received the link on. You can just hit reply and send us those ideas, and we will certainly try to find an expert to talk about it. We hope you enjoy the rest of your Sunday, and we will see you next month. Thank you so much, and thank you again, Heather.